Hello, good morning, all of you. So, this is Mistry sir. I am taking today's online class. Okay, sorry, not online, that is a audio based class, right? As I did discussed in our previous session, that is syllabus, right? So, from today, we will discuss the, or sorry, we will start the our first chapter, that is prescription, right? This is this is the content of today's session, right? Have a look on all slide. This is the topics we will be covered in today's session, right? See, right, let's start, right? So today we will cover the definitions of prescription and part of prescription, right? These two content we will discuss in today's class, right? That is part of prescription, that is date, name, age, sex and address of patient. Then superscription, inscription, subscription, signature, renewal instruction, signature address and registration number of prescriber, right? This content we will be studied in today's session, right? Only this content, right? Okay, just this is the prescription. This is the exact definition of prescription, right? So prescription is a written order or command from doctor or physician or other licensed practitioner to the pharmacist to compound and dispense the specific medication, right, for patient, right? The prescription is a written by the doctor to the pharmacist in order to compound and dispense the specific medication, means whatever medicines doctor are wrote on prescription, right? And these medications are prepared by pharmacist for whom, for the patient. ओके मतलब जो प्रिस्क्रिप्शन का जो एग्जैक्ट डेफिनेशन है वो मतलब जो प्रिस्क्रिप्शन है वो डॉक्टर लिखता है और वो जो प्रिस्क्रिप्शन है किसे दिया जाता है, फार्मासिस्ट को, ठीक है? क्यों? क्योंकि फार्मासिस्ट जो लिखा हुआ मेडिसिन से उसे बना सके, दैट इज़ कंपाउंडिंग एंड डिस्पेंस कर सके, मतलब उसे डिलीवर कर सके, किसको? पेशेंट को, ठीक है? दैट इज़ द definition of or meaning of prescription, right? Then actually the prescription contain the direction for the pharmacist as well as patient, right? जो prescription है वो डायरेक्शन रहता है उसमें फार्मासिस्ट के लिए भी और पेशेंट के लिए भी. जैसे कि फार्मासिस्ट के लिए लाइक डॉक्टर गिव अ डायरेक्शन to compound or prepare a specific type and quantity of medication, right, for the patient. And also prescription contain the direction, means how to administer it and when administered, right? Means the direction for the administration or mode of administration of drug for the patient, मतलब पेशेंट के लिए और पेशेंट के लिए मतलब मेडिसिन को कैसा लेना है, ठीक है? देन कैसा एडमिनिस्ट्रेट करना है वो भी डायरेक्शन दिया होता है. मतलब प्रिस्क्रिप्शन में दो लोगों को डायरेक्शन दिया जाता है, एक तो फार्मासिस्ट को और पेशेंट को, ठीक है? देन प्रिस्क्रिप्शन इज अ वर्क एज अ मीडिया, राइट? वर्क एज अ मीडिया थ्रू विच द ट्रीटमेंट इज प्रोवाइडेड फॉर द पेशेंट, राइट, बाय द combined skill and services of the both physician and pharmacist, ठीक है? तो प्रिस्क्रिप्शन ये एक मीडिया है जिसके थ्रू जो डॉक्टर्स एंड फार्मासिस्ट है वो सर्विस प्रोवाइड करते हैं, किसको? पेशेंट को, ठीक है? फॉर द ट्रीटमेंट. ओके, दिस इज द मीनिंग ऑफ प्रिस्क्रिप्शन. ओके, आर यू अंडरस्टैंड? देन स्टार्ट विथ इट्स पार्ट. This is the part of prescription, right? This is the part of prescription. First is date, as we said, as I said, that is date. It helps the pharmacist to know the filling or prescribing date of prescription. Then prescription must contain a date if which prescribed narcotic or habit forming drug to avoid its misuse. ठीक है, तो it is very necessary to uh, show the date or write a date on a prescription, right? It is become very helpful if very helpful to the pharmacist for find outing the prescription, when prescription is prescribed, right? That is exact date. And it's become very important if the prescription contain any kind of narcotic or habit forming drug, right, to avoid the misuse. Means if prescription contain the narcotic drugs, means habit, the drug which is cause the sleep, right, means it is a habit forming drug, also narcotic drug. That's why it has become very necessary to mention the date on prescription, right, in order to मिसयूज़. एक्चुअली अगर प्रिस्क्रिप्शन में अगर नार्कोटिक ड्रग या फिर हैबिट फॉर्मिंग ड्रग प्रिस्क्राइब करते हैं, ठीक है, देन उसे अगर जो पेशेंट है वो अगर एक्चुअली जब प्रिस्क्रिप्शन लिखा जाता है तब प्रिस्क्रिप्शन में डेट मेंशन किया जाता है, भले ही वो प्रिस्क्रिप्शन पुराना क्यों ना हो, ठीक है. तो सपोज़ करो अगर समटाइम कोई नार्कोटिक ड्रग प्रिस्क्राइब करता है, ठीक है, तो नार्कोटिक ड्रग प्रिस्क्राइब करने के बाद फार्मासिस्ट से मेडिसिन लेगा, ठीक है, देन विदाउट अगर डॉक्टर के सजेशन से या फिर राइटिंग से अगर देन दोबारा अगर रिपीट करता है फार्मासिस्ट, ठीक है, मतलब डॉक्टर के साथ बिना कंसल्ट किए अगर नार्कोटिक ड्रग लेता है, ठीक है, तब जाके प्रॉब्लम क्रिएट हो सकता है. इसलिए उसे मिसयूज़ बोला है, इसलिए वो मिसयूज़ ना कर पाए इसकी वजह से जो डेट है वो मेंशन करना बहुत ज़रूरी है, ठीक है. थैंक यू. देन और सेकेंड पार्ट इज नेम, एज, सेक्स, weight and address of the patient, right? This is the second part of our prescription. This part must be included because it's helps to identify the prescription. Then age and sex of the patient help the pharmacist to check prescribed dose of medication. If the patient is children, weight of patient also help to calculate the appropriate dose of medications, right? This is the content of, or sorry, importance of this name, age, sex, weight and address of the patient, right? So this information are become very helpful for the pharmacist to identify the prescription, right? prescription जो डेट है, जो नाम है या फिर एज है, देन एड्रेस है, वो अगर प्रिस्क्रिप्शन में लिखा रहता है तो फार्मासिस्ट को आसानी होती है कि वो अच्छे से आइडेंटिफाई कर पाए प्रिस्क्रिप्शन को, ठीक है. देन एज, सेक्स एंड वेट बिकम वेरी इंपॉर्टेंट फॉर कैलकुलेटिंग द डोज, बिकॉज देर इज अ three kind of people like children, adult and elder, ठीक है. That's why there is a difference of dose which whatever we gives to children, that is not referred to our adult patient, right? That's why there is it become a very important, that is to write a age, sex and weight of patient in prescription whenever the doctor prescribe the prescription, right? Then our third part is superscription, right? Superscription, it is shown by the symbol RX. It is written before writing the prescription. RX is a Latin word meaning take through, or in English word, that is you take. In olden days, the RX considered as a sign of Jupiter, that is god of healing. That is Jupiter means god of healing, right? God, one kind of god, and requesting to God for the quick recovery of the patient, ठीक है. Then RX is a simple one. RX is a one kind of symbol, right? One kind of symbol. It is a right. It is right before and on the top of the prescription, left hand side of the prescription, right? After writing this, then the name of medicines, then what kind of doses need to prescribe the doctor simultaneously write on prescription, right? Before writing the name of drug, the doctors always write the RX symbol, right? RX, right? Hence there is a shown, it is a written before writing. Then RX is a Latin word. Actually the RX is a Latin word. The meaning of RX in Latin, that is take thou, right? Take thou. This is the Latin meaning of RX, but in English meaning is you take. You take. That is the English meaning of RX, right? Then in olden days, meaning ancient days, not ancient days, in olden days, RX considered as a sign of Jupiter, right? Means that is Jupiter is a god which heal the patients, right? And that's why is a mention, that is god of healing. So requesting to the god for the quick recovery of the patient, means the doctor request to the drug what particular patient is coming for treatment, they pray for him, they will quickly recover, right? मतलब तो RX जो है वो लैटिन वर्ड है, उसका जो टेक टू है जो लैटिन मीनिंग है, और इंग्लिश में उसे टेक यू बोला जाता है। और जो एक जो पुराने दिनों में जो RX लिखा जाता था वो जुपिटर को रिप्रेजेंट किया जाता था, ठीक है, जुपिटर को रिप्रेजेंट किया जाता था जो है गॉड ऑफ हीलिंग, और रिक्वेस्ट करते थे डॉक्टर लोग कि हमारा जो पर्टिकुलर पेशेंट है वो जल्दी से रिकवर हो जाए, ठीक है। देन इंस्क्रिप्शन, राइट, दिस इज द मेन पार्ट ऑफ आवर प्रिस्क्रिप्शन वेयर द नेम ऑफ ड्रग, देन डोज ऑफ ड्रग आर रिटन, ठीक है। इंस्क्रिप्शन, it is the main part of prescription order, contain name of and required quantity of ingredient. The name of ingredient are written in the English or Latin language, or sometime abbreviation also used. Inscription is divided into following part, that is bases, adjunct and vehicles. Nowadays suitable formulation are available, so pharmacists only need to dispense ready-made medicines. Due to this reason compounding of prescription eliminated, ठीक है। तो inscription is a middle part of prescription, right? Middle part of prescription. This is the inscription that is the middle part of prescription, right? Cod liver oil, this is the quantity and name of drug, right? Ingredient, this is the inscription. Right, inscription is a main part of our prescription, in which the name of ingredient and required quantity of ingredient are written, right? The name of ingredient either written in English language or Latin language, but sometime abbreviation also used, that is a short form. Abbreviations means short form. जो ingredient का नाम है एक तो English language में लिखा जाता है या फिर Latin में, या फिर sometime abbreviation भी use करते हैं, ठीक है। That inscription are divided into three parts, that is base, adjuvant and vehicle, right? The base is means our active drug, right? Active drug means the drug which produce the therapeutic use or pharmaceutical action, right? And adjuvants means our all kind of excipients which helps to increase the palatability or activity of drug, right? And this is the vehicle. It is a one kind of water, it helps to our drug to dissolve, right? That's why also help to increasing the volume of any kind of preparation, right? This is the main part of inscription. But there is a nowadays a suitable formulation are available, means nowadays there is a compounding are totally omitted or eliminated because ready-made medicines are available in our market. Hence the pharmacist not required to compound any kind of medicines, only just dispensing is happening, right?